If we assume all of this is true, what does this mean for you as a dude? So I know this sounds kind of weird, but the first thing that I'd recommend is that you actually seek psychotherapy if you're struggling in some way. And that may sound weird because you said, Dr. K, there's a systemic bias. Yeah, but it's still the best evidence-based treatment that we have for dealing with mental illness. Medication is just as good, by the way. And another thing we need to keep in mind is that there are randomized controlled trials on many types of psychotherapy, which show that they are equally effective for men and women. So it's not like psychotherapy works. It's just that if you're engaging in psychotherapy as a man, there may be a couple of things that we can arm you with to really make that psychotherapy really worthwhile. So the first recommendation that I have is that you see at least 3 psychotherapists, or at least you see at least 3 before you give up on therapy. If you love the first one, then stick with them. And so a lot of psychotherapy is about fit, and it may just be hard to find someone who's able to communicate with you in a way that is helpful. So a couple of things that I would recommend, some language that you can use if you go to psychotherapy. So the first is just simply let your therapist know, hey, I'm not really aware of what I feel all the time, and I'm not very good at articulating my feelings. Because oftentimes therapists will say, how do you feel? And as dudes, we don't know how to answer that. So just be transparent with them at the beginning. Another thing that I'd recommend is that y'all check out this idea of normative male alexithymia, which is this idea that men are, by default, it's normative, so it's like most men are colorblind to their